Crohn's disease, which is a chronic form of inflammatory bowel disease, the other being ulcerative colitis. It is also called as regional enteritis. The inflammation in this type can affect any part of the gastrointestinal tract. And due to this chronic inflammation, there can be a bowel obstruction as one of the complications. Those with this disease are at a greater risk of colon cancer and small bowel cancer. Cigarette smoking is one of the main risk factors for developing Crohn's disease, the other being genetic or environmental factors. Underlying cause could be due to body's immune system defending the gastrointestinal tract, possibly targeting microbial antigens. So it is not autoimmune disease. In entire gut, especially colon and terminal ileum are most commonly affected. The symptoms which are experienced can change over time as inflammation increases and spreads. Due to this, presentation is different for each patient. A barium X-ray can show where and how severe the Crohn's disease is. The intestine appears to be patchy because of scarring. The endoscopic appearance of the intestine may show irregular muscularis mucosa and increased fat wrapping, which is due to hypertrophy of mesenteric fat. They call it as creeping fat as due to its migration from the abdominal fat. The cobblestone appearance of the mucosal surface is due to longitudinal and circumferential fissures and ulcers. Crohn's disease usually presents with discontinuous inflammatory lesions that frequently involve the ileocecal area, whereas ulcerative colitis mostly presents with rectal inflammation and continuous lesions. Transmural inflammation is when the inflammation begins in the mucosa, but again it eventually involves all the layers of the mucosa. The persistent chronic inflammation in the intestinal mucosa can lead to centimeter-sized tears or cracks known as fissures. Also, it can cause scarring, which can narrow the lumen of your intestine. So, strictures are much more common in Crohn's disease than they are in colitis. Abdominal pain being the initial symptom presents in lower right quadrant of the abdomen. One of the most common symptoms of Crohn's and colitis is the presence of blood in the stool. The color of blood in the stool varies depending on the site of bleeding and the transit time. In the upper GIT, it is black in color, and in the lower GIT, it is bright red in color. The mouth may be affected by recurrent sores known as aphthous ulcers, which can lead to cobblestone appearance in mouth also. If the inflammation in the intestine persists, it can lead to various complications like toxic megacolon, strictures, and anal fissures. Harvey-Bradshaw Index uses abdominal pain, number of stools, abdominal mass, joint pains, and few other signs and symptoms. Each sign or symptom is assigned a number. If your total score exceeds 4, you have an active disease. And if the score is 16, then you have a severe disease. Complications outside GIT includes anemia, skin rashes, arthritis, and inflammation of eyes and fatigue. Perianal discomfort due to anal fissures may be prominent in Crohn's disease. Inflammation and persistent diarrhea are the main culprits for the causage of anal fissures. Two most common skin problems affecting Crohn's and colitis patients are erythema nodosum and pyoderma gangrenosum. Intestinal endoscopies are the most accurate methods for diagnosing Crohn's disease and ruling out other possible conditions such as ulcerative colitis, diverticular disease, or cancer. Clusters of inflammatory cells called granulomas can be seen in the CT scan. The barium X-ray of lower abdomen shows narrowing of the end of the small intestine, that is ileum. There is no cure for Crohn's disease, but the treatment helps to subside symptoms and prevent from recurring again. The treatment mainly consists of anti-inflammatory medications such as corticosteroids, which can reduce the inflammation, and immunosuppressants, which is used to slow the progression of the disease. In case of severe Crohn's disease, the large intestine, that is colon, may be removed partly or the whole, which is a procedure called laparoscopic ileocecal resection. One of the complications during the surgery is continued bowel paralysis.